Hi, I'm Ed Koviak. We're going to be doing another instructional video about acupuncture oriental medicine treatment of an injury. This is Andy Marlowe. He's going to be, we're going to be doing some work on his hand and wrist. And we're going to start out by getting some history and context about what's going on here. And can you tell me the history of the injury, what happened here?
About 4 months ago, I was chopping brush with a machete, grabbing a brush and swinging the machete, and end of the day, overworked, underrested, had deflected on the backswing of the machete and realized it was sticking in my wrist. Brother was cutting brush with me. I severed tendons and refractured an old fracture of the scaphoid.
So there were almost 3 days between the actual injury and the surgeon getting in to look at it and figure out what was going on.
Yeah.
Okay. How has it been since then?
This limited range of motion, and they also took a skin graft off the top. I believe the scar adhesion is limiting the glide of the tendon.
Okay.
And so I've been working on reclaiming the hand, bringing strength to it with putty, stretch bands.
So you've been doing a lot of
ultrasound,
physical
right,
rehab.
Liniments, massage. What they said later in the reports was that since so much time had passed, since I wasn't airlifted at the time, some of the tendons retracted, or muscles.
And so I want to talk about some of the things that came out of the doctor's report. So the scaphoid bone, which is one of the carpal bones, was fractured in 3 pieces. Is that correct? And then there was also a fracture of the end of the radius. And so during the surgery, part of what they did was they put a screw into the 3 pieces of the scaphoid bone to hold them together. And then they also drilled and put a wire connecting the piece of the radius back. So there were those 2 bone injuries. But then there was also severe injury to the tendons. So the extensor carpi radialis longus and brevis, which are 2 forearm muscles that actually the belly of the muscle is up towards the elbow in the forearm. And then they each have long tendons that come down and attach in the hand. And so those tendons were severed. There were pieces of the tendon still attached to the bones at the hand, and then when you get an injury like that, where the tendon is completely severed, the strength of the tension in the muscle actually pulls it back up towards the muscle. And as in this case, unfortunately, if too much time goes by between the injury and the surgery, then the doctors are not able to lengthen that muscle enough to get the tendon long enough to reattach the 2 ends. In this particular situation, what happened was, again, there's 2 muscles. There's the extensor carpi radialis longus and the extensor carpi radialis brevis. And they essentially, during the surgery, they took a piece of the length of the tendon of the extensor carpi radialis brevis and used it to graft onto the longer one, and were able to reattach that tendon. So the extensor carpi radialis longus does have a tendon graft in there, and it is attached to its original attachment of this distal end of the tendon. However, in this case, the extensor carpi radialis brevis is not attached. The other primary injury that happened here was that the there's two other muscles here that attach to the thumb, and they also come right through this area. And those two muscles are called the extensor pollicis longus and the extensor pollicis brevis. And those two were also severed. And so they had to look for the attachment, or the distal ends of the tendon that were still attached to the bone up here, and try to figure out how are we going to reattach those two tendons. So the anatomy is that the extensor pollicis longus attaches to the ulna over here, and then it comes diagonally down this way. It comes all the way down and attaches, let's turn that way, attaches towards the distal phalange of the thumb here. And so that muscle is responsible for being able to raise the tip of your thumb like that. And the extensor pollicis brevis follows a very similar pathway, but it's shorter, and its tendon attaches to the base of the thumb here. And so that muscle is responsible for extending that joint like that. Again, what they found when they went in for the surgery was that the tendon of the extensor pollicis brevis was damaged to the point where they were not able to actually use that much. So what they did was they took the two tendons coming down this way and they joined them together, and then they were able to join them to the distal end of the tendon of the extensor pollicis longus. So what we have is two muscle groups that are, or two pairs of muscles that do very similar functions, similar but different functions. And because of the nature of the injury, the function had to be combined. So structurally, there's some rewiring that went on in there. Is that correct?
Yes.
Okay. And the situation that leaves you in now is that you are able to
Make a fist.
You're able to make a fist.
Move my fingers.
Move your fingers, okay.
But I'm, as of yet, unable to lift my thumb more than that.
Okay. So it looks like they may have in the surgery been able to take some of this brevis tendon and attach it to the longus tendon. In which case there should be, from the report, there should be some potential, there is some structural connection there. And so the amount that you're going to be able to recover from with that is going to be influenced by, what is the new capacity of the structure, but we don't know that yet. And so it's possible that through treatment, or a part of our hope through treatment, is to maximize your function to the level that is possible with the new anatomical,
Right.
like that.